Hi guys, today we're going to talk about narcolepsy. It really isn't as common as I originally thought it was because I have several patients who actually have it. But it does affect 25 to 50 people per 100,000 patients. Some call it a sleep disorder. However, there are others, especially in the neurological field, that call it a neurological disorder. It's very unpredictable in who it will occur and when it will occur, which that's the worst part about this mystery, because really you can be put into a dangerous situation if you've never had it before, and boom, there it shows up. Basically, it makes you drowsy, extremely drowsy, during the day. It's hard to stay awake for extended time periods. So if you have to work an 8-hour day or a 12-hour shift, it's hard for you to do that. There are two types, type 1, type 2, and then there's actually a secondary one which occurs due to trauma. But it is lifelong. Unfortunately, there is no cure for it. However, there are treatments and ways to manage it. Some of the symptoms that you can see in especially type 1 is cataplexy, which is a loss of muscle tone. You will just go limp. And it only lasts for a few minutes, so it's not like you're going to be permanently paralyzed or anything like that. But if you're standing up, if you're driving, if you're using heavy machinery, it absolutely can be a dangerous situation. So you want to be careful of that. And if you are on a blood thinner, you've got to let your providers, all your providers, know what's going on, because you would be at risk of falling down, hitting your head, and bleeding out. So that's very important to know. With the cataplexy, it normally is triggered by intense emotions. And it not just negative. I mean, you can be frightened or whatever, where that may occur kind of like a fainting goat. But if you were having a positive emotional response, say you just got engaged or you found out you were going to be a parent or a grandparent, that emotional response can also cause it. So it's not just negative along that. Something else that you can see is sleep paralysis. And with that, it generally happens when you're falling asleep or coming awake. And with it, that's what happens. Your muscles are gone. You're paralyzed. But again, it's short term and you do come out of it. Some other symptoms that you may see is automatic movements. And it's just in the autonomic nervous system where you may be asleep and you're doing that with your lips. You may be doing something with your fingers. You don't realize you're doing it, but everyone around you knows you're doing it. And that is indicative of having narcolepsy. Amnesia also occurs with this, where you're having trouble with your memory. That can be due to the narcolepsy, but it also can be due with people not getting enough sleep. You have memory problems, and that is because you're not letting your brain shut off to recuperate. You also can see outbursts, especially when you're awakening. You literally will go off and then basically strike out, that kind of thing. That's something you can see. And then the other one is kind of opposite of what you may be thinking, and that's insomnia at night. When you're trying to go to sleep, you can't fall asleep. You can also have hallucinations, and that can occur anytime, but mainly during when you're starting to fall asleep or when you're coming awake. You think you're somewhere that you're not. Part of the reason is with normal people, when they have REM sleep, it takes 60 to 90 minutes to achieve REM sleep. And REM sleep is important because that's when your body and your mind actually start to rejuvenate. They take the full break, everything comes off. You dream when you have REM sleep. With narcoleptic patients, REM sleep is achieved within 15 minutes. So it's easy to see why you would be having hallucinations and also acting out because of that. The cause is unknown. However, they do believe there is some genetic component to it. There's a strong risk of having it if you have parents or grandparents that have it. as well as it is a dysregulation in the hypothalamus. And because of that, like in type 1, you get decreased levels of orexin. And it could be due to an autoimmune reaction, because they've also linked exposure to the swine flu. People who have been exposed to the swine flu, have had the swine flu, there's a higher number of those patients that seem to have narcolepsy. For one reason or the other, they can't really figure it out. Like I said, there's, as far as risk factors, the main people that are getting it are between the ages of 10 to 30. Men and women are pretty much equal. If you're obese, you're going to have a higher risk factor. Family history, you're looking at a 20 to 40 times higher risk factor if you have parents that have it. Men can get it more often than women, depending on, and some of that has to do with maybe the trauma related, like I said, because secondary narcolepsy occurs due to trauma. If you have had a stroke, tumors, or head injuries, you're going to be more prone to get it secondarily. Well, a lot of men play football, especially in high school and junior high. A lot of concussion protocols went unnoticed until about 10 years ago. So this could be why. As far as tips, number 1, try and be consistent with your sleep. If you go to sleep for 8 hours, try and get 8 hours every day. If you go to bed at 10 o'clock, try and get 10 o'clock at night. Every night should be your deal. You've got to make time for sleep. You cannot leave that out. You shouldn't, whether you're a narcoleptic patient or not, you should make time for sleep. But if you have narcolepsy, you really have got to take the time. Exercise, but don't do it an hour before bed. Do it earlier in the day, but the exercise seems to help, and it could be having to do with the triggering of dopamine. Avoid caffeine intake. Avoid tobacco use, and avoid alcohol. All 3 of those can make your narcolepsy worse, okay? Try and take naps during the day if you can, or if you're a shift worker, take naps in your off hours. That seems to help out as well. And then relax before bed. If you're like me, TV's on till 10 minutes before bed, or you're on your phone till 10 minutes before bed. Try and take a half hour before you're actually going to bed and get off of social media, get off the TV to let your body shut down. The other thing I want to remind you is do avoid dangerous activities, because as I said, it's very unpredictable, and I wouldn't want you driving a car or going for a mile-long swim type situation and it hits you, because it can put you in dire straits. As far as treatments, there is some medications to induce wakefulness, like modafinil is one, and armodafinil. They stimulate the CNS, or central nervous system, to promote wakefulness. Some other ones are amphetamines, so some of your ADD medications can be used. Adderall, Ritalin, things like that. Antidepressants that are prone to keep you awake would be ones that they would look at. And along those lines, you may look at something like paroxetine or escitalopram. But remember, if they are making you drowsy, let your provider know right away, because obviously it's having the reverse effect on you, because those can go either way. Xyrem is another medication. It really helps out with the cataplexy that I talked about, where you lose muscle control. It's sodium oxybate, okay? Wakix is another medication. It's a histamine receptor antagonist, WAKIX. And it goes against the histamine effects, where if you take like Benadryl or something like that, it can make you drowsy. This drug antagonizes that. All of these medications can cause hypertension and heart issues. and there is several drug interactions. So you want to let your whole care team, especially your pharmacist, know what's going on and know where you're at, and it is best to fill all your medications in one place so they can watch out for that. And like I said, really pay attention if you have a heart history in your family or you personally, because there are cardiac risks with the medications involved.